Hey everybody, it's Summer here back again today, and I am here today to demonstrate on how to prick a patient's finger. But to start out with, I want to let you know that one of the rarest blood types is having AB. Most people don't end up having it. Most people have, as you know, there's 4 blood types. There's A, B, AB, and O. And A, B, and O will have positive or negative behind it. And it's very rare for a lot of people to have AB. The universal blood type to give is O. So a lot of people that have O donate blood and help others when they have or need blood during surgeries or need a transfusion. So today I'm going to start out with just telling you some facts and stuff before we get started on how to prick a patient's finger. I have a little chart over here to the side just because I don't want to tell you the wrong numbers. For your blood sugar, your normal range is about 120. You can kind of fluctuate, probably about 120, 140, somewhere along there. So I'm actually going to tell you that when somebody is fasting, their blood sugar is going to be lower. Their normal blood sugar is going to be about 80 to 100, where after eating, your blood sugar is going to go up, and it's going to be about 170 to 200. And obviously, about 2 to 3 hours after eating, you should be coming back down to normal, which is about 120 to 140. So that right there tells you a little bit on where you're supposed to be normally with your blood sugar. When it comes to having your blood sugar, most people say when you get up in like 200s, you're kind of getting in a scare area. When you get past 300, you're starting to get into a diabetic coma. That means your blood sugar is too high, and most people are diabetic already and have insulin, so they take insulin. If you go too low, then you also are going into a diabetic coma, and that then you will be needing to eat something. So for me personally, I have had that happen to me before, and peanut butter is one of the best things to bring your blood sugar back up. Keep a pack of nabs around, keep a jar of peanut butter around, something just to pull your blood sugar back up until you can get a good meal inside of you. Now, the reason today that I chose to do pricking a finger on a patient is because both of my parents are diabetic, and this is something they have to do daily. Majority of the time, I do have to prick my mother's finger because she doesn't have very steady hands and can't really do it herself. My father does his own, and it's something they have to do normally about 2 times a day, if not 3. So we're going to kind of get on with this and explain everything. When, like I said earlier, type O is a universal donor, so they can kind of give to anybody and help, others out, whether you have A, B, or AB and or O. A and B can only donate to themselves and AB. And then AB can only donate to itself. So I hope that kind of makes sense to you. So it's basically saying AB can only donate to itself and people that have an AB blood type. And then AB blood type can only donate to AB blood type. It kind of goes on further than that, like I said, the O can be universal, can give to anybody. Most people have machines that are very simple when they take their blood sugar. Like this is one right here. It's very simple. This is what you call your glucose meter. It's a very simple machine. You just stick the glucose strip that's right here into the machine, and you're going to put your blood on this end. And it takes normally maybe 5 to 10 seconds at the most, and it will tell you your blood type. Or not your blood type, I'm so sorry, your sugar level. How to figure out your blood type is when you are born, they will take a sample of your blood to figure out which blood type you have, and your blood type is inherited from your parents. So that kind of really tells on where you figure out, and most people later on in life do get another test because you don't necessarily remember what yours is. I personally do not, so I've had one done just to remember exactly which one I am. So it helps me in the future when I donate blood on, hey, who am I actually helping in the future? Am I just helping, A or AB? Am I helping, everybody? Just kind of something that everybody really needs to know is what kind of blood type you do have. I'm going to go ahead and start on this. So you need to have an alcohol swab right here, which is just an alcohol wipe. You're just going to wipe down and sterilize your area. This is your glucose meter, your glucose strip, and this is what you will use to prick your finger. I have already personally changed the needle so it didn't take up extra time in the video. And I did get a Band-Aid because some people bleed more than others. Obviously, if you were doing this on a patient, you're going to wear gloves. I do not have gloves on. I'm doing this on myself today. So that is the reason why. You're always going to make sure that your back piece back here is pulled back so that your needle is ready. And then these have actually notches on them. They're kind of hard to see, but it tells you, you know, how far kind of or how the deep depth of the needle going in. So, you know, it's a good prick or if it's not. So to start out with, you're going to find the meteor finger, just one of the three. A lot of people like to use the middle three fingers, whichever one they are. And you're going to pick which one you want. I have used this one already, so I'm not going to pick this one. I think I'm going to go ahead and do my pointer finger. And you're just going to take your alcohol swab, clean it up. I'm going to go ahead and put the glucose strip into my glucose meter so that it is ready. And then you just put it on the end in your meteor spot. Prick your finger. You get blood. You're going to put some blood onto your glucose strip. And then you can take your alcohol swab and just kind of put back over it. If they need a Band-Aid, a Band-Aid. And my sugar level right now is 101. So that is how you do a blood sugar test. And I hope you guys enjoy. Thank you.